Our aim is to provide top educational content and awareness about fatty liver disease to healthcare professionals, patients, and their families. So today we are honored to have Dr. Manjinder Singh, a renowned gastroenterologist from Zirakpur, Punjab, as a guest speaker. With over 13 years of experience in the field, Sir is known to provide exceptional care to his patients. Sir, your contribution towards spreading awareness about MASLD is truly commendable. So we are grateful for his dedication to improving liver health. So without further delay, I would like to invite Dr. Manjinder to share his valuable insight about MASLD. Over to you, sir.
Thank you for the introduction. I'm Dr. Manjinder, practicing as a gastroenterologist in Jaipur, Mohali. So today I'm going to talk about a topic which is highly prevalent in India as well as worldwide population, that is steatotic liver disease, which was earlier the nomenclature was non-colic fatty liver disease. Later, they have changed it to metabolic dysfunction associated with steatotic liver disease, and similarly MASH instead of NASH. So we're going to talk about the current perspectives about the disease, what's new in the evolution for the treatments, for diagnosis, and what can be done at your level in order to improve the outcome of the disease. So I'll be leading the topic through following subheadings. So I'll be discussing introductory part, then diagnosis, and then last the management part. So as you know, liver is the second largest organ of human body, weighing around 1,500 grams. It's located in the right upper quadrant of the abdomen, on our top of stomach and intestines, and is soft consistency. It is pinkish brown in color and highly vascular structure. So we all know the functions. It metabolizes the food we eat and it detoxifies the blood. So along with that, it breaks down all the medications, drugs we take. So MASLD, that is metabolic dysfunction associated fatty liver disease, is a condition wherein fat comprises at least 5% of the weight of the liver, which is not otherwise caused by alcohol intake. So if it is left untreated, it can progress to MASH, that is one stage in the evolution of the disease, which has inflammation and could be associated with fibrosis. And if that goes unaddressed, it can evolve into compensated cirrhosis, finally decompensated cirrhosis, and or hepatocellular carcinoma. So there are various risk factors for developing the MSLD. The most common ones are being overweight, obesity, diabetes, hypertriglyceridemia. Other factors are alcohol and some genetic causes of the disease, like mutations in PNPLA3 gene, which metabolizes the fat as a lipase activity. So that also increases the incidence and chance of steatotic liver disease. And lastly, some drugs too can contribute to the steatotic liver disease. Naming a few like corticosteroids, we have amiodarone, then there is anti-epileptic drugs like valproic acid, and there are anti-HIV drugs too, and some immunomodulatory drugs like methotrexate. So they have a cumulative dose, like for methotrexate. So if it is patient keeps on taking it without getting his liver screened and doing the regular blood test, the liver can get fibrosed and later change into cirrhosis. So if you look at the prevalence of the disease, it is quite common in India, and the prevalence ranges around 30% in Indian population. It is higher in patients who are already obese and are diabetic. Male gender has been regarded as a risk factor for progression of MASH and fibrosis. So this is how the progression of the disease takes place. You have a healthy liver when the fat deposits in it. That is up to 5% of the liver gets Up to 5% of the liver, we have fat deposition. It changes into fatty liver. And thereafter, the next stage is liver fibrosis. And thereafter, the disease can progress to cirrhosis. Difference between fatty liver and MASH. So, fatty liver, steatotic liver disease is simply accumulation of fat in the liver. And for MASH, there is inflammation and fibrosis going on, which is an additional stage for patients of fatty liver. Steatosis will lead to inflammation of the hepatic cells, and it is associated, it is known, steatosis will lead to inflammation of the hepatic cells, and it is known as metabolic dysfunction associated steatohepatitis. Scarring of the liver on benign stage is also known as fibrosis. So causes I already listed. So there is obesity, some genetic background mutations like PNPLA3 genetic mutations. Processed foods, refined sugars, fruit juices, they can all contribute to obesity and lack of exercise, certain medications I already told, and then metabolic syndrome, that is diabetes, hypertriglyceridemia. Similar situations are the major causes of metabolic dysfunction, also associated with steatotic livers. One other cause is alcohol, but that is cause of steatotic liver disease, but it is not a spectrum of MASLD. So alcohol in itself can cause steatotic liver disease, but it is a different variety of steatotic liver disease. So, like I said, obesity is a risk factor for fatty liver disease, though they go hand in hand. So, being overweight or obese causes the fat to accumulate in the liver, and obesity increases the amount of fat to constitute 5 to 10%, and ultimately leads to mass and scarring of the liver. So, the relationship between the MSLD and diabetes is bidirectional. So there is threefold increased risk of death due to cirrhosis. Similarly, for diabetes, there is increased risk of MASH, and vice versa too. Patient with the fatty liver, they have a higher prevalence of diabetes, and they have a risk of two to fourfold of developing diabetes. So symptoms of steatotic liver disease or MASH. So you have upper abdominal pain, nausea, which could be there for any chronic liver disease. So you may have nausea, jaundice, abdominal pain, weight loss. If the fibrosis tends to worsen, you may have complications or development of portal hypertension, wherein you could have splenomegaly, engorged vessels of esophagus called esophageal varices. A person may be extremely fatigued. So these are various symptoms which are common to almost all causes of chronic liver disease. So diagnosis wise, it is the earlier symptoms are very vague, so frequently overlooked. Like they said, it can be a silent killer because the progression of the disease is very gradual. So diagnostic tests often involve the following, that is blood tests first, to be followed by ultrasound or fibroscan. Ultimately, few patients may need a liver biopsy for quantification of the disease and to rule out coexisting etiologies. Similarly, at times CT and MRI used to assess the disease. So blood tests, the common ones are the liver function. So herein you encounter elevated ALT levels, which are associated with the disease progression. So the ratio of ALT to AST is again, the ALT is higher in patients who are NFLD, and it is reversed for patients who are alcoholic. So patients with normal ALT can also develop progressive disease. Up to 80% of the MSLD patients can have normal liver function ALT levels. And there is no designated cutoff to define a MASH or advanced fibrosis in patients of MASLD. So there are various scoring systems too, non-invasive tests to define the fatty liver. So you have FIFO and NFLD fibrosis score, which can help you grade the fibrosis. So, non-invasive methods and other non-invasive diagnostic methods include ultrasound, which is very economical and is easily available. And it is a reason for pickup of most cases of MSLD. But on the downside, detects MSLD only if the fat content is more than 25%. Like I said, at least 5% of the fat deposition in liver is represented by fatty liver. So the specificity is low for picking up a fatty liver on ultrasound. The specificity, I mean. And it cannot differentiate between the fat and fibrosis. So this can be overcome by transient elastography or fibroscan, which is a new method of diagnosing MSLD. So it can quantify fat with at least as low as 10% and is helpful to differentiate fibrosis and fat content. And it's easily operable, and there is some drawback of it too, especially if you use a lower probe size for these patients. So there can be a misinterpretation. So fibroscan can assess liver stiffness, which grades the fibrosis. And the other parameter we get on fibroscan is the cap value. It quantifies the degree of fat in the liver. So these two values help us make the diagnosis of fatty liver, the stage on which fibrosis is there, which can help us plan the treatment too. Another modality is MRI scan. It is considered as a gold standard to detect the fat content, as it can detect the fat content as low as 1%. And on the downside, it is not widely available and is very costly. Ultimately, at times, when there is diagnostic dilemma, uh, we need to opt for liver biopsy, which is considered the gold standard for diagnostic MSLD, and it is the only method which has been used to diagnose MASH. Other is just you get a indirect evidence of MASH, but on biopsy you can get a direct evidence of MASH. And at the same time, you can rule out other causes of liver disease. And on the downside, it is a painful procedure, and chances of misdiagnosis are there in the early stages of MSL. So this is a natural progression of the disease. So any patient who has a steatotic liver disease, the majority remain in isolated fatty liver with none to very minimal progression to the fibrosis. And there is no increased risk of death in general population. And in 20-25% patients, the MSLD progresses to MASH. Out of these patients, uh, another 10 to 11% go on to develop MASH cirrhosis. From MASH cirrhosis, the risk of decompensation is around 30-40%, and the risk of SCC is around 7% over 6.5 years. The MASH, when the MSLD transitions to MASH, there is increased risk of death compared to general population. There is higher cardiovascular death rate, malignancies, liver-related comorbidities. NASH with fibrosis portends worse prognosis. So it is associated with diabetes, severe insulin resistance, rising ALT, AST levels. So fatty liver at the stage of MSLD is reversible, but once it transits into MASH, it is not always reversible. So one needs to act, in earlier stages before it gets too late. So on treatment side, the treatment is customized, not, you know, uniformly applicable to everyone, but there are some advices or, lifestyle modifications which are applicable to majority of the people, especially who are overweight. So you should incorporate diet with high fiber, with low glycemic index, which is not processed, you know, and exercise regularly, limit your alcohol intake, limit your smoke intake. Similarly, then there are drugs which are there to encounter the problem. So as they say, like losing at least 3 to 5% of the body weight helps you to improve steatosis. And you should put in a hypocaloric diet and moderate intensity exercise, which should help you to sustain a weight loss. And up to 10% of weight loss helps you to, have the improvement of mass histopathology, including fibrosis. So you can see the effect of weight loss on MSLD various stages. So fibrosis regression up to 45% is seen if a patient loses 10% of the body weight, which is quite high. Similarly, many patients like NAS resolution occurs in 64 to 90% in patients who lose at least 7% of the body weight. And ballooning inflammation decreases by 40 to 100% if you lose your weight by 5%. Steatosis improves in majority, that is 35 to 100% in patients who lose weight at least 3%. So there are various diets for a healthy liver. One example is Mediterranean diet, where you include moderate portions of poultry, eggs, cheese, and yogurts, and every day base each meal around vegetables, fruits, whole wheat grains, olive oil, beans, nuts, legumes, seeds, and herbs and spices. And less often you should use red meats and sweets, and you need to incorporate more of fish and seafood. And the exercise part, there are, aerobic exercises and there are resistance trainings, both of which help you to, reduce the liver inflammation and fat. It depends on, your phenotype, your capabilities. So if, one may consider the isotonic as well as isometric exercises for the improved, liver outcomes. So to sum up the lifestyle tips to tackle MSLD, so develop an exercise, routine, get enough sleep, vitamin, minerals should be incorporated where required. Regular medical checkup should be there, and the food part, you should be eating, small, frequent meals instead of heavy meals. And you need to lower your sugar intake too. So pharmacological approach, finally, as per the, Indian National Association for Study of Liver Disease, endorses, following drugs. So you have pioglitazone, which helps you to, it is indicated for patients with the or without fibrosis in both diabetic and non-diabetic population. Similarly with saroglitazar, which is a PPRA alpha and gamma agonist, and that too is indicated in patients with or without fibrosis in both diabetic and non-diabetic population. And vitamin E is to be used only in non-diabetic adults and in patient of NASH with or without fibrosis. So suggested duration of treatment is listed here. So pioglitazone needs to be given at least for 2 years. Similarly, saroglitazar for at least a year, and vitamin E over a period of 2 years. So diet-wise, again, limit your saturated fats, avoid processed foods, refined carbohydrates, quit smoking, limit your alcohol, exercise regularly, take medications where required. Thank you.
Thank you so much, sir, for wonderful talk. Sir, now we have received a few questions from audience. With your permission, can we start?
Yeah.
Sir, how common MASLD and MASH in Indian population?
Yeah, the prevalence ranges is slightly higher in urban population, but if you take an average with around 30% of the patients, we see with fatty liver on OPD basis. So the figure is around 30%.
Okay. So what is the ideal diet recommendation for MASLD patient?
You should be on a hypocaloric diet, and the meal portion should be small. You should be eating frequent and small meals. Avoid processed foods, refined carbohydrates, fruit juices. You should not be taking, and incorporate more of complex carbohydrates. Whole grains, which tend to stay in your stomach for longer periods, make you satiated for longer times, so they can help you lose weight too. So on the other hand, patients who are taking refined sugars, processed foods, they get easily metabolized. They make you put on more weight rather than helping you lose weight. So this is the dietary
Yes.
advice.
And what kind of exercise will you recommend?
Exercises, you should can incorporate both isotonic and isometric exercises. Isotonic, like doing a plank or a push against the wall. These are isotonic exercises wherein joint movement is not a much role in that. So that gives you overall stamina. And similarly for isometric exercises like gymming, cycling, they too can help you lose weight. So, and this is the major way to help you lose weight. So exercise, especially isometric and isotonic, should be incorporated in your lifestyle to help you lose weight and get rid of the fatty liver.
All right, sir. Now, on behalf of Nash 24 by 7, I extend my sincere thanks to Dr. Manjinder for his enlightening and engaging talk on myself. I also want to express my appreciation to our audience for their participation. Please stay connected with Nash 24 by 7 on Facebook page for upcoming updates and information. Take care, stay well. Thank you so much, sir, for joining us today. Thank you.
Thank you. Thank you for giving me this opportunity. Thank you.